Hi class, welcome back. Now let's take a look at the major blood vessels of the heart. So blood flow through the coronary arteries are going to deliver oxygenated blood to the myocardium. So the coronary arteries, here is the arch of the aorta, here's the pulmonary trunk. So we can see the right coronary artery right here, and then coming from in here, you can see the left coronary artery. Now, if the pulmonary trunk, if this was cut out of the way, we'd be able to see the origin of the right coronary and the left coronary coming right off of the ascending aorta. We'd see them both arising there. Okay, so it's through this coronary circulation, the right and left coronary arteries, that's going to bring oxygen and nutrients to the myocardium to make it contract. And then we have the veins of the heart that are going to remove the carbon dioxide and the waste products. And all the veins converge into the coronary sinus to bring the deoxygenated blood back into the right atrium. So on the left-hand side, we're looking at what comes off the coronary arteries. So right here is the right coronary, and over here is the left coronary. And you can see that the pulmonary trunk is cut, so you can really see the origin of those two coming off the ascending aorta. Here's the ascending aorta, here's the arch of it, and then here's the descending aorta. So off of that right coronary, we have the marginal branch, that's important. And off the left coronary, there's a circumflex branch that's going to wrap around to the posterior. And there's your anterior descending. Your anterior descending is also known as the anterior interventricular branch because it's going to follow where that interventricular septum is, but on the outside, there's a groove or a sulcus called the interventricular sulcus, and that's where this large blood vessel, the anterior descending, aka anterior interventricular branch, flows down. Now, if there's an anterior interventricular branch, there's going to be a posterior interventricular branch, but it's on the posterior side. That's why the color red looks a little lighter, because it's on, you have to go around to the posterior to see it. Now, on the other side, on the right-hand side, we're looking at the coronary veins. So let's look at some of the biggies. There's a small cardiac vein. There's an anterior cardiac vein. There's a middle cardiac vein. There's a great cardiac vein. So you have small, great, anterior, middle, and let's not forget on the posterior side, right in here, coronary sinus. Okay, when I come back, we'll talk about the EKG. Oh, I want to go back to something real quick. Let me go back to this before I pause here. There are many people that are on cholesterol medication. They're called statins. And statins are designed to prevent your body from producing an excessive amount of cholesterol. One of the downfalls to these is that statins decrease vitamin K in the body. And when you decrease vitamin K, you decrease something in the body called matrix GLA protein. And the purpose of matrix GLA protein is to take calcium that's in your blood vessels and to take that calcium that's in your blood vessels and to drive it into bone. So basically taking calcium that's in soft tissue and bringing it into hard tissue. So when the statins decrease the amount of vitamin K that we have, vitamin K is needed to activate matrix GLA protein. If you can't activate GLA protein, then the calcium stays in your blood vessels. You get calcification of the blood vessels, which increases your blood pressure. And when these things become blocked or clogged with calcium, that's when they end up putting stents in. They put stents in there to open it. So you have to be very, very careful. Even when taking vitamin D, I always tell my patients, if you're taking vitamin D, it has to be vitamin D with K in the formulation. Good companies make vitamin D3 with K in it. Otherwise, you can end up with high blood pressure if you're deficient in vitamin K. Okay, when I come back, we'll get into the EKG.